Thank you, Dr. Dutt, for your presentations. Very interesting. You quoted a lot of references there. Have you got any of that laid down on paper, as it were, that you could provide to the committee?
Absolutely. Yep, we can definitely do that.
Thank you. So one of the interesting things is, you mentioned British Columbia, I think, and the study that was done before they embarked on instituting their paid sick days in BC. Now, they've been in place for a year. Have you seen anything yet in terms of evaluating the cost benefits of this paid sick days that were instituted in British Columbia?
I haven't seen an evaluation yet. I'm not sure if that's been made public, so I can follow up on that, but I haven't personally seen an evaluation of their implementation.
The examples we've heard, as you've mentioned and the previous presenters mentioned, were from American cities, New York, San Francisco, where apparently they've done those kinds of evaluations. I don't know how long Quebec's paid sick leave has been in place, so do you have any idea if there's been an evaluation done in that province?
That I don't have. I did have something on Quebec, but I don't have that right in front of me, so I apologize. No, I don't have the Quebec stats in front of me. So again, when we submit something in writing, I can put that in.
With respect to outbreaks in the workplace, in businesses, we know about COVID, but what sorts of other maladies or diseases get passed around in a workplace that could lead to a workplace-wide outbreak?
Yeah, so as you all probably know, the role of public health, part of it is to respond to outbreaks. So the types of outbreaks that we see are through organisms that may be transmitted through person to person, or through food, or through water. So some examples, like I mentioned, are things like hepatitis A. Norovirus is a very common one that we do see outbreaks of. There's a whole host of respiratory viruses. You've probably seen impacts, or I know you've seen impacts in your healthcare system of RSV, of influenza, parainfluenza, a whole range of respiratory viruses. And so those are some. Salmonella, we see that also sometimes through food. So there are numerous organisms that through a range of different ways we see outbreaks, and often it may, through no fault of their own, be connected to an employee. Perhaps they didn't know that they had the infection, or as we saw in the pandemic, people really didn't feel like they had a choice, even if they had symptoms. So they went to work sick because they couldn't lose that income, and then ended up infecting others.
And with respect to norovirus, actually, how would that be spread in the workplace? Because we've been hearing about an uptick in the incidence of norovirus.
Yeah, norovirus, it's fecal oral, so meaning that there's some kind of transmission between feces and then to somebody else. So it's not kind of the most pleasant thing to think about, perhaps, but it could be, simply it's very easy to get this infection with a very small number of virus particles. So you may just have the tiniest bit on your hands. You touch the surface, you touch someone else's hand, it's easily transmitted to them. So it is one, even kind of in a washroom, it may be transmitted through some of the aerosolization from a toilet. It really is quite easy to transmit, and anyone who's had norovirus knows that you can get very sick. It's very unpleasant, and it's definitely not something you want someone to be going to work with if they do have those symptoms.
Okay, thank you very much for your answers and your presentation. I'll turn the questions over to colleagues now.